These standard non-invasive tests allow doctors to see your heart and lungs in detail, as well as any problems in the bones and around your lungs. Electrocardiogram or ECG. These tests measure your heart's electrical activity. MRI. This scan uses radio waves and a magnetic field to produce detailed images. Pulmonary angiography. This test involves making a small incision so your doctor can guide specialized tool through your veins. Your doctor will inject a special dye so that the blood vessel of the lung can be seen. How is a pulmonary embolism treated? Anticoagulants, also called blood thinners. The drug heparin and warfarin prevent the new clots of forming in your blood. They can save your life in an emergency situation. Clot dissolvers or thrombolytics. These drugs speed up the breakdown of a clot. They are typically reserved for emergency situations because side effects may include dangerous bleeding problems. Surgery for pulmonary embolism. Vein filter. Your doctor will make a small incision, then use a thin wire to install a small filter in your inferior vena cava. The vena cava is the main vein that leads from your legs to the right side of your heart. The filter prevents blood clots from traveling from your legs to your lungs. Clot removal. A thin tube called a catheter will sanction large clot out of your artery. It isn't an entirely effective method because of the difficulty involved, so it's not always a prepared method of treatment. Open surgery. Your doctor uses open surgery only in emergency situations when a person is in shock or medication aren't working to break up the clot. Prevent venous stasis. Encourage ambulation and active and passive leg exercise to prevent venous stasis. Monitoring thrombolytic therapy. Monitoring thrombolytic and anticoagulant therapy through INR or PTT. Manage pain. Turn patient frequently and reposition to improve ventilation perfusion ratio. Manage oxygen therapy. Assess for signs of hypoxemia and monitor the pulse oximetry value. Relieve anxiety. Encourage the patient to talk about any fears or concern related to this frightening episode. Caused by a blood clot usually starting in the lower legs, this pocket can block the flow of blood to the lungs and can be extremely dangerous. Common causes include injury or damage, inactivity, and medical condition. Symptoms of pulmonary embolism are shortness of breath, chest pain particularly upon breathing in, and coughing of blood. Signs of pulmonary embolism is low oxygen level, rapid breathing, rapid heart rate, and sometimes a mild fever.